Welcome to the first session of Kidney Action Week 2022. On behalf of the American Kidney Fund, we are thrilled to have you join our session, Home Dialysis, What to Know and What to Ask. Home dialysis can provide patients with end-stage kidney disease with more flexibility about when to dialyze, fewer food restrictions concerning food and drink, and better health outcomes, in part because people can dialyze more frequently than is typical in the center. Home dialysis is growing. However, even today, only 15% of patients dialyze at home. Over the next hour, we'll address some home dialysis misconceptions, discuss the importance of working with a care team, and discuss how to explore your treatment options with your doctor. Before I go any further, I would like to thank our sponsor and my employer, Satellite Healthcare. And without further ado, let's get started with a few brief introductions. To give you a little background about myself, my name is Eric Weinhandel, and I am currently the Senior Director of Analytics and Home Therapies at Satellite Healthcare, a nonprofit dialysis provider. I am an epidemiologist, and I have an extensive background in researching kidney disease and home dialysis. In my past, I have worked at both the United States Renal Data System, which is the National Registry of End-Stage Kidney Disease and sponsored by the National Institutes of Health, and at NextStage, a manufacturer of home hemodialysis equipment. Although I have spent years examining both home hemodialysis and peritoneal dialysis, the reality is that I am not a physician and I am not a patient, and there is absolutely no substitute for either of these experiences. I'm happy to be joined today by a nephrologist who specializes in home therapies, as well as two kidney health advocates who can speak to their own journeys with home dialysis and how it has impacted their lives. As a nephrologist, Dr. Maria Camila Bermudez is passionate about home dialysis modalities. She is currently an associate professor of medicine at the Geisinger Commonwealth School of Medicine and the associate program director of the Nephrology Fellowship at Geisinger Medical Center. Dr. Bermudez's area of work focuses on advancing care of patients requiring dialysis by promoting home therapies, education, as well as empowering patients and healthcare professionals. Our second speaker is John Baton, who is an accomplished project and marketing professional. John is a good friend of mine. Diagnosed with end-stage kidney disease in 2003, John Baton has undergone 2 transplants. He has experience with every modality of end-stage kidney disease treatment, including in-center hemodialysis, peritoneal dialysis, nocturnal dialysis, and home hemodialysis. His experience with kidney disease inspired him to become an advocate for the kidney community. He is the Director of Strategic Planning for Home Dialyzers United and head of the professional board. John is a member of the American Society of Transplantation's Public Policy Committee and an ambassador for the American Kidney Fund and National Kidney Foundation. John is a frequent speaker on matters related to end-stage kidney disease, dialysis, and transplantation. And rounding out our speakers today is Kyle Chang. Kyle was diagnosed with end-stage kidney disease in 2013. He started with in-center hemodialysis, as many people do, performed peritoneal dialysis for 5.5 years, and has done home hemodialysis treatments post-recovery from a double nephrectomy, or kidney removal, in 2018, and is now post-deceased donor transplant as of December 2019. Kyle administers and moderates some of the largest home dialysis modality support groups, including the Peritoneal Dialysis Support Group, Home Dialysis Central Facebook discussion group, both of which are excellent resources for patients. He also enjoys traveling around the world for work and leisure, and home dialysis modalities offer him the flexibility to do all the things he loves. He is regularly called upon to speak on his experiences with plant-based diets, chronic kidney disease, dialysis modalities, advocacy, pre- and post-transplant topics, and can be found on various social media under Kidney Journeys. We're grateful to have all of you today. We will answer your questions during the last 15 minutes of this session. You're more than welcome to type your questions and comments into the window next to or below the Facebook Live video or the chat box to the right if you are here with us on the Kidney Action Week website. We will try to answer as many questions as possible, likely contingent on how well I can stay organized looking at the questions. We are going to have a great discussion and many questions to answer, so let's get started. And with that, I will turn it over to Dr. Bermudez, who has some great content prepared for us today.
Thank you very much. All right, trying to advance my presentation here. We're having some, very good. All right, so welcome everyone to our home dialysis session. I want to thank all of you for joining us, and of course to the American Kidney Fund for this invitation. It's truly an honor. For the past 11 years of my practice as a nephrologist, I've committed most of my time to the care of patients on their more advanced stages of their kidney disease journey. I care for patients on all types of dialysis, in-center and home dialysis. To be able to see my home dialysis patients achieve independence, regain control, but most importantly, improve quality of life, and many instances towards kidney transplantation as their end goal has been a true inspiration and have made me a true advocate for home therapies. So with that being said, in the next slides, I hope to provide a helpful overview of the different types of dialysis at home, and hopefully some tips and guidance on how to approach this important process of deciding whether home dialysis is right for you. So the first question that comes to mind is, how do these therapies compare to each other? So the main difference would be to remember that our kidneys work every day of our lives to clean our blood from waste products, to eliminate excess of water and salt. Home dialysis, through being more frequent, imitate what our own kidneys do for us in a better and more physiologic, more gentle way, as compared to in-center dialysis that happens more infrequently, more like 3 times in a 7-day period. So with that increase in frequency, benefits come with home therapies. We're going to be gaining less fluid in between treatments. This is going to give us steady cleaning of our blood, like the kidneys do. It's going to be less stressful on our heart. We're not going to be gaining a lot of fluid in between treatments. We're going to have less fluctuation of our blood pressure. And for the most part, more energy. All our patients share with us that after home dialysis therapies, their recovery is much faster, sometimes just a few minutes to a few hours, as compared to in-center dialysis, where it could take several hours to regain energy back to baseline. And last but not least, I should have said it as first, there's more room for a liberal diet, so you can enjoy mostly potassium-rich foods in a more liberal way. So as you approach to make this decision about whether home dialysis is right for you, I encourage my patients to take a 3-step approach. The first step is to get to understand the different modalities. The second, and probably most important in my mind, is to do a soul search and really think about who you are as a person. What is important for you? What is your role in society, in your family? What are your hobbies? What do you enjoy? What type of dialysis can accommodate to my lifestyle, as opposed to what do I have to give up in order to do dialysis? And the last and final step is to meet with your care team, to meet with your nephrologist after you've gained all of that information, you've had time to think what your goals are, and together as a team decide which dialysis is best for you. So with that, let's go ahead and talk about the types of home dialysis. So peritoneal dialysis, we call it PD, is a very gentle dialysis that uses no needles and no blood. So you may wonder, how does that work then? So inside our abdomen, right underneath the skin, we have this membrane called the peritoneal membrane. Think about it as a blanket, like a sponge that is full of blood vessels and is going to act as a filter. So the way this works is we are going to teach our patients to administer a clean solution that has good electrolytes and sugar. Is going to go into the abdomen through a catheter. And then this membrane that is acting as the filter is going to absorb all the good things from this solution. And in exchange, is going to let waste products and excrete excess of water and salt through the same tube. So why do I need to do peritoneal dialysis? So you, of course, need a healthy peritoneal membrane. Most patients are able to do this and have healthy membranes when they're born. If you've had a lot of surgeries in the abdomen and perhaps the scars have formed in the membrane, perhaps the membrane is not a good filter, your physicians will help assess that for you. You will require an access, that is the catheter I mentioned before. This is a simple procedure, which is ambulatory in and out. A surgeon or radiologist will place a catheter into your abdomen. This will allow the fluid to be infused into the abdominal cavity and then to release the excess of water and impurities. You need a suitable home. For the most part, we as a team, we achieve all goals for your home to be suitable. You want to have enough space for supplies, and you want the space where you are doing your exchanges to be clean. You need capacity to be able to learn how to do this, but if there are barriers, as long as you have assistance, you also can be a good candidate for this therapy. So what are the types and logistics of peritoneal dialysis? So training duration varies between usually a week and a half to 2 weeks, depending on the learner. Some people will require less or more time, but average would be about 2 weeks to learn how to do this. Frequency of doctor visits would be twice a month. You will meet your whole team, including your nephrologist, dietitian, social worker, once a month, and you'll visit your nurses also one more time to get your blood work. There's home visits before initiating therapy, then every year, and more often if necessary. There's 2 different ways to do this. We can do manual exchanges, and that's where the patient learns how to hook up the solution that I mentioned to the catheter manually, let it fill, and then learns how to drain. The patient will do this during the day at different frequency. It varies per patient. Many patients like to do it during the night, and for that, you will use a machine, what we call a cycler. This will go next to your bed or recliner, and we use the nighttime to perform dialysis, to free the day hours to other activities of daily life. Now let's switch gears to home hemodialysis. So as in-center hemodialysis, we require blood to be accessed from the body and to pass through the dialysis machine to be cleaned. So how does home hemodialysis work? What do I need? So the first thing is we need an access to be able to remove blood from the body. As you see in the slide, there's 3 accesses. The first one is the preferred one. It's called a fistula. This is a procedure also in and out, ambulatory. A surgeon will connect a vein and an artery together, and this will be prepared ahead of time of needing dialysis. It is the preferred access because there's no foreign material into your veins. Therefore, there's less risk of infection. The second type of access is called a graft, and that is for patients that have tiny veins that are not able to have a fistula that matures or grows. This access will increase slightly the risk of infection, but it also continues to be a good access. The third option is a dialysis catheter, which I'm sure many of you are familiar with. In a sense, this is a very helpful access which allows us to do dialysis as soon as it is placed. But because it is a foreign material that is connected to your heart, it will increase the risk of infection significantly. So if needed, we prefer that this access is used just temporarily. You also require a suitable home, and your nurses will address that for you when they do the home visit. And last but not least, you'll require capacity to self-perform. Yes, you can do home hemodialysis by yourself in many situations, or have a partner that does it with you. The types and logistics of home dialysis. So training duration is about 4 to 5 weeks. It would also vary per patient. Frequency of doctor visits will be once a month. Most patients are actually trained how to draw their blood work and do it in the comfort of home. So that way they need to be seen by their team just once a month or more often if necessary. There's also going to be home visits conducted before initiating therapy once a year and more often if necessary. There's different types of home dialysis. Some patients do what we call short daily hemodialysis. Most patients do about 4 to 5 treatments a week. And some patients do nocturnal hemodialysis, similar to peritoneal dialysis, to be done in the comfort of the nighttime. So in summary, we have different types of home dialysis, peritoneal dialysis, home hemodialysis, with a very dynamic way to do it either during the day or during the night. The second step I mentioned before, once you learn about the different types of dialysis, is to think about what your goals are. In this slide, we can see the patient is in the center of this decision. So you have to think about what is your profession? Do you have or like to travel for a hobby? How important is dietary modifications to you? How's your heart? Do you have a weak heart? Where a home therapy that is more frequent and more gentle would be more beneficial to you. So with all of that, you're going to meet with your team and your nephrologist. And together, you're going to decide what is the best modality for you. Your team will have a lot of tools to be able to assess that. This is a busy slide, but just to show you, this is a very helpful tool called MatchD, where you can see there's 3 lines of green, yellow, and red. This is a questionnaire that helps your team determine if you're a good candidate to be doing dialysis at home. If you work, if you're independent, if you like to travel, if you like to take control, you're a great candidate for home therapies. If you're elderly and it's hard to transport back and forth from dialysis, if you live in an area of the country where winters are very hard and it's difficult to mobilize to dialysis units, lots of different aspects that can really make you a great candidate for home therapies. So really the importance endpoint of my slides is to encourage you to reassess your treatment options over time. You may initiate with in-center dialysis, which is very common for many patients, but you need to consider all your options and know that you can transition to other types of dialysis at any point of time. So I thank you for your time, and of course, we'll be answering more questions in the next part of the session.
Thank you for joining us today, Dr. Bermuse. That was an excellent presentation, very helpful, a lot of good background information. I know it can be very overwhelming for people who are on the verge of starting dialysis to think about dialysis at all, let alone dialyzing at home. Let me ask you a few questions. First of all is that sometimes in discussions about home dialysis, you'll hear conversations about ideal candidates for home dialysis. And so I want to start with just a very simple question. You know, if a person is watching today and they're interested in doing dialysis at home, whether they're a male or female, young or old, I mean, is there any reason for a patient not to begin discussing home dialysis with their physician?
That's a great question. And in my opinion, everyone is a home dialysis candidate until otherwise proven. There's a lot of misconceptions and biases about who is a good candidate and who's not. So I truly, truly encourage all of you to consider home dialysis as your first choice of therapy, even if perceived barriers are encountered. And I can almost assure you that your team can, in many instances, help you overcome this barrier for you to become a home candidate.
Appreciate that. I found that to be my experience as well, that there are many, many nurses and physicians throughout all of dialysis that are very interested in helping home dialysis be successful for people who want to do it. What are some of the things that patients and their care partners as well, people living in the same house, let's say, should consider if they are interested in beginning home dialysis? Maybe just a few really sort of key points that you would want people to think about.
So the main thing that I'll start with is that there's plenty of experience now across the globe that home dialysis therapy improves quality of life. I would also say we have plenty of experience knowing that these are safe treatments, that you will be properly trained, and that honestly, I think it will be give you fulfillment as an individual and to your family members. There's a lot of interest in decreasing biases. I always would say again, if you encounter that your team may not be as enthusiastic, strongly consider thinking outside the box, looking for other centers that might be helpful for you to achieve this if this is your goal.
Okay. And let me ask you two questions that seem kind of simple, but they do come up very frequently because, of course, people wonder about these things. First of all, a dialysis unit is, typically a kind of big building, right? Lots of space required. So let's say that I live in a small apartment or a small house. Do you think that I can fit home dialysis into my space?
I will be completely honest. In 11 years of practice, not once limitation of space has been a barrier. There's a lot of things that we can do. A good assessment is if you have enough space to fit in a regular refrigerator, you're probably going to be okay. Even when the space is very limited, there's things we can do. Instead of delivering supplies once a month, we've done to patients where we deliver them twice a month, so they have less supplies at a time. I've had patients whose family members that do have more space do receive the supplies for their family members. So there's things we can do outside the box to eliminate that as a barrier.
Okay, well, that's very helpful to know. The second question is that we spend a lot of time thinking about the humans in the house, but of course, many people have animals in their house, and those are just as important as family members for many people. So if I have pets, can I do home dialysis?
Absolutely, yes. That's another big misconception. I have a pet myself. We all know how smart they are. All we need to know when we do this home visit, we're going to meet the pets, assess the situation, and help your pets understand what their limits are. So we're basically going to assure that the space where you're doing your treatment, especially when you're doing your exchanges, of course, we won't like the pets to be there. But, absolutely, you don't have to get rid of your dog or your cat. We work with you to create a safe space for everyone in the home.
Okay. And then one more question before I want to turn it over to John for a little bit and hear about his experience. I think it can be difficult for people to sort of who start on home dialysis to appreciate maybe how home can be different for your quality of life than in center. Whereas for those patients who actually are in center and then switch to home dialysis, it's a little bit easier to understand the before and after. In your experience as a physician, where do you see the biggest quality of life changes or improvements when people switch from in-center dialysis to home dialysis?
So the one thing that is amazing to hear is I mentioned it briefly, is the recovery time after treatment. It's shortened beautifully. My patients at home, they tell me they just feel back to normal. Their energy level just, bounces back very, very soon after their treatments. I think that has been the most critical and thing that we all appreciate, I think, on each individual. So much that I'm able to tell my patients that I promise them that is going to happen.
Well, I think it's a good promise, right? We have really strong evidence from multiple trials showing that recovery time is one of those things that improves quite dramatically when people are on more frequent dialysis schedules. So excellent observation. And I think really important. It's hard for, I think, anybody who hasn't been on dialysis to fully appreciate how much of your time can be devoted to recovering after a treatment until you've experienced that. I'd like to switch over to Mr. Baton here. I'd like to understand a little bit more and tell us, our audience, a little bit about your experience with chronic kidney disease and ultimately how you got to home dialysis and why it was the right choice for you.
Okay. Well, I first want to start out by saying thank you for having me as part of this conversation today. I really appreciate it. Eric, as you said earlier, I was one of I've experienced every modality of treatment that there is, and you mentioned the range. my journey actually began in August of 2003, one of those dates you just never forget, when I actually crashed into dialysis. Went to work one morning and was feeling off. Before I knew it, I had gotten sick. My teammates rushed me off to the hospital. And then sitting in the emergency room after multiple tests, they basically diagnosed me with end-stage renal disease. And that was really my first introduction into kidney disease overall. I have to admit that my knowledge beforehand was very limited. I knew about many of what the other organs did, but sadly did not really know much about what the kidneys did. And before I knew it, I had been outfitted, as I call it, with my permacath in my chest and sent off to an in-center dialysis unit and proceeded to do dialysis 3 days a week over the course of what they call their Tuesday, Thursday, Saturday schedule. Looking back, I think one of the things that really led me to go through all the different modalities was because, as Dr. Benitez referenced earlier, I analyzed my life over a period of time. And basically assessed that at different points, I was more ready to do something else than I was before. And I looked at those things in my life that I wanted. My occupation in particular required me to travel. I loved traveling. It wasn't just a requirement. I loved being able to travel and move about the country. And also as part of I attend a lot of events and do a lot of networking luncheons and everything else under the sun that you can imagine. And I longed for that freedom again. I was very fortunate to have an employer who really worked with me during that time. And as I would say, after about the third month of being in center, I looked at other options, which first include peritoneal dialysis, and said, yes, I can do peritoneal dialysis. I have the ability. I was single at the time and had my own place. And so it just fit for me. Did peritoneal dialysis for about 3 years. Then I became a transplant recipient in 2009. That was my first transplant. And of course, that transplant changed everything. But the peritoneal dialysis actually allowed me to get to that point because it really prepared me for transplant, is how I kind of looked at it. Being able to take care of myself, recognize my own symptoms, improving my communication between my physicians, feeling good overall and liking that feeling and wanting that feeling to continue were some of the things that I really enjoyed about home dialysis, about peritoneal. Long story short, moving on, I kind of went from there to transplant. My transplant actually failed in 2016, which I suddenly found myself back in center. And once in center again, I realized that I'm a little too independent to be in center. And I am a little bit of an introvert. So having a lot of people around me kind of drove me a little nuts for a while. So I immediately began looking for other options. And my nephrologist was a huge proponent of home dialysis, and particularly home hemodialysis. And that's when I transitioned to home hemodialysis, which I have to admit I loved. The machine was no bigger than a fax machine, allocating space and so forth for my supplies. As Dr. Benitez referenced earlier, I did the 2-month delivery. I had my deliveries delivered twice a month so that I could accommodate in space. And I'm also very into aesthetics, making sure things look good and feel comfortable and not crowded. So I was able to work those supplies into my own little feng shui per se. And I felt amazing doing home hemodialysis. I would literally feel, it's kind of hard to explain, like getting off the machine, I didn't feel tired. I didn't feel, lethargic or anything. I literally just got off the machine, disconnected, cleaned up, and laid in bed, watched TV. I'm a late night person, so that wasn't impacted. And overall, just like the freedom it gave me, I chose to do mine late in the evening, and basically the time I would be home anyhow. But it didn't keep me from living my life and working and doing the things that I enjoyed. It just required a little planning around that schedule. And the frequency of doing home hemodialysis, I think, is what led me to feeling great all the time. And in fact, once I started, I ended up going to the ER, and it was totally a non-kidney related item. So I didn't experience any problems or any difficulty, and found the training period to be very, very practical. And learned it very quickly, but was also comforted by the fact that they weren't going to let me go until I felt comfortable being able to do it alone. And then even when I did it, there was still support afterwards. I don't want to go on too much more. I could probably, go on the entire session, but I know Kyle has a few things he'd probably like to add too.
Greatly. I especially appreciated the fact that your journey does include multiple times around home dialysis. I think that, practically speaking, a lot of people who do find their way to home dialysis may be at home for a period of time, several years, let's say, and then they go in center, and just generally speaking in our country, we don't see a lot of people who have a second time or a third time doing home dialysis. And I think that's kind of a lost opportunity that people often, when they go in center, don't end up returning back to home dialysis when it fits their lifestyle again. So it's really nice to hear your experience. Yes. I certainly have some questions for you, but I do want to switch it over, as you said, to Kyle. And here's some about his experience as well, and his perspective on home dialysis, which, every person is different. Every person has a different experience. So it's always great to hear a diversity of those.
Everybody, once again, it's Kyle Chang out of Chicago with Kidney Journeys, and thanks for allowing me to be here to speak with you all. And thanks for the great introduction and the great background, Eric, as well as the doctor, in terms of home dialysis modalities and different options. My journey, there are some similarities to what John explained, and then there are some differences. So I ended up, before going into chronic kidney disease, I sort of crashed into it twice. The first time was at the first hospital system, and they only had the hospital acute dialysis where they brought it to your hospital rooms. And I went into the hospital actually for a different infection. And then through that, the different labs that they assessed through ER and also through the admittance, they discovered there was issues with the kidney. So they just came in and said, hey, we're starting dialysis. No background, no information, no modality options back then that was expressed. And that particular nephrology team was sort of outsourced for that hospital. And they presented no other dialysis options, which is very different than these days. We did the 3 sessions in the hospital, and then I was trying to wrap my head around the entire situation of needing dialysis and what the life was going to be. A little bit scary, a lot of anxiety that comes through. What am I going to do with travel, work, other people that depend on me for my employees in terms of the income and jobs, as well as other family members that depend on my support. So that was all rolling through my head. And of course, personal finances, we all know hospital costs quite a bit here in the United States. If you didn't have insurance, and I did not have insurance at the time, being only 38, I thought, hey, nothing chronic is ever going to happen. I could go through life, and I stay very active in sports activities and travel for work. Just try to wrap my head around all those things. I asked for a second opinion with that nephrology team at the first hospital, at a nearby hospital, and they said, well, we just can't do that. And to my surprise, I was like, okay, well, I guess we're done here. We'll just see what the 3 sessions do if it's truly acute, and then we'll address it there. Second time, I was fine for a couple months after that, the 3 treatments. And then second time, I was actually working a program in the city of Chicago. And then I just felt really ill, couldn't walk, couldn't climb stairs, walking very slowly, later to find out those are breathing issues due to fluid overload symptoms. And I ended up sort of vomiting fluids. And I had one of my staff members after one of our team meetings right before an event went live to just drive me to a different hospital and emergency room, the one I wanted the secondary consult with. And through there, they did do the same labs test and diagnosed me with chronic kidney disease at that time. Stayed at the hospital for 3.5 weeks. We were trying to figure out everything out. What's the cause of my kidney failure? Nobody knew. They think it's most likely secondary to long-term hypertension, and that not being managed as well regularly without regular insurance at that time. So from there, we went into the outpatient in-center hemodialysis locally. And then that first dialysis unit was quite a trippy experience for somebody brand new to dialysis, not knowing what's happening. We had a pediatrics unit. It felt sad for me to see all these little patients coming in and being braver than me every day doing their dialysis treatment with their parents coming in and out. And then we had a lot of elderly and disabled patients at that particular clinic, people that had lost limbs for different reasons, or sometimes there were patients that were arguing with each other on the treatment floor, and sometimes patients and clinicians were arguing with each other. So it was not the best environment mentally for me. I did that for about 5 months until somebody from Fresenius came in with a demonstration home hemodialysis machine at the time and was talking about, hey, have you thought about doing home dialysis? And that was the first time I was ever introduced to anything relating to home hemodialysis or PD. And at that time, back then, about 13 years ago, they require a care partner to do home hemodialysis, and that's not necessarily the case these days, even though for safety protocols, many clinics do recommend a different spouse or some family member be nearby if you do home hemodialysis at home. But these days, you can certainly do it on your own as well. I did it solo as well when I did home hemodialysis, but that trainer also talked to me and said, well, since you don't have a care partner, have you thought about peritoneal dialysis? And that piqued my interest. I said, oh, well, I could do that myself since I was living single at the time. And so we talked a little bit more about it. I talked with multiple nephrologists that were part of the clinical team that was responsible for my care in center. And they actually expressed to me that if they had to do dialysis themselves or they have family members, they would actually choose peritoneal dialysis first as the first option. And they also knew I wanted to get back to work and travel more. So that's how I ended up on peritoneal dialysis for the next 5.5 years. And it certainly did give me a great opportunity to feel much better, not have the sort of roller coaster up and down from the hemodialysis treatments only 3 days a week, being very fatigued, where on the surface, it seems like you can save a lot of time and have less work. But with the crashes I was getting after the treatments and not understanding how to manage that with the clinical teams at that point, at the beginning of my dialysis start, it just took a real toll on me. I couldn't really work. I was on disability for months, for over a year, and then trying to process that with getting listed for transplant. So there was quite a bit going on. And transitioning over to peritoneal dialysis at home, it allowed me to get out of that clinical environment that was not very healthy for my mental health to be there, but also I did it at home. I could watch TV at home. I could run support groups at home if I was staying up late while I'm doing my PD treatments, as well as travel for work, which I did several times while on PD for months at a time. And it just varies depending on clinical policy in terms of how flexible they are with you in terms of those types of travels. And we certainly know patients that go on cruises, either with PD or home hemo, as well as travel and do treatments in their RV sometimes, as well as they're sort of spending time with their family and friends, seeing the rest of the United States to different sites of interest, as well as going overseas in different countries. And so there's many different ways that can be done. But I did it for work, and I was able to take my little small printer that John mentioned there, along with me on different trips. And technology has also gotten better in terms of the size and the flexibility of using these peritoneal dialysis machines these days. As you travel, it's lighter and it fits in a basic regulation carry-on that you could put in the overhead of most aircraft as well. And then you can certainly ship the solutions ahead of time. So that's what happened. And then everything went well for 5.5 years. But as I get closer to getting a transplant. The transplant team discovered cysts that were growing on my native kidneys, and they recommended the removal of both kidneys, and that's where the double nephrectomy that Eric mentioned at the beginning of the intro came in. And I had a cool story to tell folks for over a year, about 13 months, in terms of, hey, I'm walking around with no kidneys. I'm still alive, so I'm the guy with no kidneys. And but that tossed me back, and I was not able to return to peritoneal dialysis at the time because the second catheter placement didn't work as well. And we went back in center, and I've learned so much over the 5.5 years doing home dialysis and running support groups at that point to know how to better address different things in hemodialysis clinic environment with the team there to make the up and downs a little bit more manageable and less for that. So I appreciate the home dialysis for that education. And we weren't quite getting the kidney offers, and we had some time. So I figure, you know what, why not? Let's try a brand new modality, learn more about it, since we're talking about it in support groups and when I'm speaking with different groups as well. So let's hit home hemodialysis for a while, and went through training with that. And did that for several months before my deceased donor transplant. So that is sort of a long and short story of my experience there, and what I do and how I learn a lot of things that surround all these different modality topics, and also diets that we were talking about each year and every day. And so far, everything's going well post-transplant as well. Thanks, Eric.
Well, thank you, Kyle. That is just fantastic. And both you and John, just really inspiring stories, really helpful information, I think, and really practical stuff. If for those in the audience who are just joining us today, this is Kidney Action Week. You're tuned into our first session, home dialysis, what to know and what to ask. We'll have a Q&A as the time elapses here and the rest of our time today, but don't have to wait to ask your questions. You can drop your comments in the window next to or below the Facebook live stream, or in the chat box to the right if you are here on the Kidney Action website. And we'll try to answer as many questions as possible. Kyle, I just wanted to wrap up by reiterating 2 points to our audience too about everything you described here. One is that, realistically, healthcare professionals have all sorts of skills, just like every one of us does, right? And there are things we're good at and things we're not good at. And it is important to recognize that you may encounter a nurse or a nephrologist who knows in-center dialysis really, really well. And you might encounter a different team that knows home dialysis really, really well. And if it isn't gelling, if you're not encountering the sort of expertise and support you need to do home dialysis, it is okay to look for another team or another professional that's going to help you. And that's okay. We're not all good at the same things, even highly trained physicians and nurses. And the second thing that I just wanted to reiterate is that notion that you described, the roller coaster. I think that's really important. I think we're so accustomed to people in our country going into dialysis units Monday, Wednesday, Friday, or they go Tuesday, Thursday, Saturday. It's so common that you might think, well, this must be okay. And for many people, it is okay, right? It is a therapy that's going to prolong your life. But for a lot of patients, I think there is a real opportunity to feel better with dialyzing more frequently. So really appreciate that. And then the last thing too, I just want to say is the travel part. We have more and more equipment today that is smaller, and it is equipment that can be taken in a car or put on an airplane. And so I want everyone who's listening today to appreciate and feel free to ask your team more questions about, if you are on home dialysis, how can you fit travel, whether that's across the country or just across your own city to family members, because I think all types of travel are important to people. Dr. Bermudez, I want to turn over a question to you. If you look at national data, one of the challenges that we have is a disparity in terms of home dialysis access. We sort of have kind of two planes insofar as we have non-Hispanic white patients using home dialysis, and overall Asian patients are using home dialysis at a certain level too that's pretty similar. But then when you look into the African American and the Latino populations, we have much less home dialysis use. So what steps can nephrologists and healthcare providers take to clarify some of the misconceptions, address barriers, and just encourage more home dialysis in our Black and Latino populations?
Thank you, Eric. Very important question. And I think the best way I can answer that is time we eliminate so many biases really about home therapies. I think most people, if not all people, are good candidates. You know, different degrees of education are okay. These training programs are fantastic. Also, barriers in terms of languages, where in this new century, there's wonderful ways to use translation. I've been able to train patients that speak Vietnamese, even Spanish. I'm a Spanish speaking, but my nurses, who are the ones training my patients, they don't speak Spanish, right? And they're using these wonderful devices and, you know, tools that we can really overcome, as I said earlier, lots of perceived barriers that are really not barriers.
Okay. John, can I ask you a question? What are some questions that you think you should ask your healthcare team, a patient who's, you know, a person who's considering home dialysis? If they are, what are some big questions they should ask to get started?
I think one of the biggest questions that they need to ask is, ironically enough, what is home dialysis and what are my options? Because I know that from my perspective, you know, I didn't really know anything about it. I knew I didn't want to be in center, but I was also very fortunate to have a nephrologist who was very supportive of home dialysis. And so when he presented it to me, that was really what my first question was: what is home dialysis? And then that was followed by, do you think I can do it? And which he proceeded, you know, to say, yes, he talked me up, he supported me. And before I knew it, I was being trained for peritoneal within less than about, I think, 2 weeks after he proposed it. So.
Yeah, and that's a great segue, actually. I wanted to ask a few questions to both you and Kyle about training. Kyle, why don't I start with you? And honestly, pick whichever modality you'd like to describe more in terms of your training experience. But tell us a little bit about how training went.
My training.
So for peritoneal dialysis, I was fortunate that my care team and nurses at Northwestern here in Chicago, the nurse was very experienced, over 25 years at the time, and she actually helped train a lot of the different nephrology fellows as well as other PD nurses around the country, and folks knew her. So she trained me about the same way that she did with different folks in terms of how to manage the treatment, and probably did a little bit more training than some of the other clinics and nurses might be across the country. But also, she just made it very comfortable. She made an easy environment for me in terms of if there's any questions, I was allowed to ask, and I would encourage patients to take a notebook with them when we talk about it in support groups. Take a notebook with whatever questions you already have before you go in for your training or before you go in for your initial treatment options discussion with your nephrologists and nurses, to just ask them these questions, such as John's example, and then also ask, can you swim on dialysis, depending on what part of the country you're in, and what are the different ways different things can be done that are used to your normal lifestyle. And some clinics will have a little bit more flexibility than others, but it's good questions to ask. The PD training was fairly easy for me. I did it on the alternate days where I did not have in-center hemodialysis training for about 2 to 4 hours per session, and then my clinic had budgeted at the time approximately 12 sessions. Nowadays, we're hearing 8 to 12 sessions, somewhere in there, of 2 to 4 hour training at a time, and then you just go through it at your own pace. And if you have a busy lifestyle, if you have kids, if you have work commitments still when you start peritoneal dialysis, certainly try to work with your clinic and address those concerns with them, and address it with your nephrologist to work out a training schedule that works for you. And most clinics should be able to accommodate as well. Now, talk a little bit about home hemodialysis training. That was a little bit different and a little bit shocker, where I didn't quite realize what I was getting into, because there is a much smaller percentage of patients that do home hemodialysis at this point compared to peritoneal dialysis. And I think, Eric, you pointed out at the beginning, approximately 15% do home dialysis, and majority of that is actually peritoneal dialysis at this point, of all the different folks that are experiencing chronic kidney disease and late stage where they require dialysis. And then my last stats for home hemodialysis is probably about 3 to 4% of that. So there was a little bit less training involved, but we do a lot of support on the online support groups on Facebook and so forth to educate folks that are interested in that modality. And then that training process does take longer. You have a different type of access that require needles, and I did all of my treatments without any fistula or graft personally because of infection risk for me personally, as well as just I really never liked big needles to begin with. So if the current kidney fails and I have to go back on dialysis, I have to really overcome that later on at some point, hopefully not soon. But you will basically, instead of going in center for your 3 times a week training, you will go into that home dialysis clinic and do your treatment as well as training during those treatments 3-4 times a week, depending on what your individual prescription need and what the training schedule is. The wait time to get into home hemodialysis training that we hear from a lot of patients, as well as my experience, is they're short staffed. So sometimes you cannot get to do that right away. So that may be a hindrance for you if you're eager to take your treatments home at the start of your dialysis. But also just be patient, and also sometimes many patients, right when they first get diagnosed, there's so many going through your minds, just like mine, in terms of all the different financial health issues, and then different people, and whether or not I'm going to stay alive and survive, just in general, that you may not be ready to have a conversation about home dialysis modalities, and that's certainly okay. We hear from some patients that it seems like the clinics are pressing that more and more on them all the time, and you can certainly tell them, you know what, I'm just not ready for that right now. Let's readdress that in 3 months, 6 months, and then we'll see how things go. Let me just settle into my new routines environment of having to do dialysis and figure out what this kidney journey is about to begin with. So that's some of the differences in terms of my own experiences, what we hear on support groups relating to the different modalities of dialysis. So hope that helps. Thanks, Eric.
Yeah, that's great. Thank you. I appreciate that. And it is true. People should always pick the modality that suits them best, both for their clinical goals, which physicians and nurses can help you with identifying, understanding, as well as the goals that you have for your own lifestyle, right? And those aren't necessarily always medical goals. So it's important to realize that sometimes in-center may be right for you, and sometimes home may be right for you. And it's okay to go back and forth between those across multiple years of dialysis. I do want to switch over to a few questions that we've gotten online. First of all, and I'll ask this to John, I guess, is travel. I just want to talk about travel one more time. Do you feel like you can travel long distances with home hemodialysis or with peritoneal dialysis?
Most definitely. I have been as far during my time on home hemodialysis in particular. I've been to San Diego, turned around and then flew up to New York, and then back to DC. I think the furthest out of the country I've been with home hemodialysis was Puerto Vallarta for kind of like a spring break, spring vacation. I found it very easy to do. Like I said, the only thing that you have to really keep in mind, there may be a little bit more planning than you had anticipated before. And that just means, making sure your supplies get there, talking to the right people, notifying your hotel. If you can dedicate about 30 to 45 extra minutes of your life to just plan and coordinate that a little bit, travel is extremely possible and enjoyable.
Yeah, definitely. Can I ask you if I could put you on the spot here? This is a great question that we've gotten online as well. And it's for both of you. Of the different types of dialysis that you've experienced, and feel free to include transplant here in this discussion as well. What is the type of dialysis that has helped you to feel the healthiest along your journey? And I'll start with you, John.
That's easy. That would be home hemodialysis. It was a world of difference. Just for me, taking control of my own health was a key element. And after repeatedly being told that there was no way that I could do dialysis at home, to be able to prove people wrong and nope, not only am I doing it, I'm doing it successfully and I'm feeling absolutely great. Literally, there was nothing that I really couldn't do. Friends, I didn't have to say no to friends, for instance, who wanted to go out and do something. I just had to make sure that my schedule accommodated, let them know, plan accordingly. If for some reason it was an evening event that people wanted me to go to, and I typically did my dialysis in the evening, I switched to the morning or the afternoon. that flexibility was incredible. So I am a huge proponent of home hemodialysis and home dialysis overall. And, one of the key reasons I actually got involved with Home Dialysis United.
All right. And Kyle, I want to jump in on that question as well. Of all of your different types of modalities you've experienced, what's helped you to feel the best?
Yeah, I think as much as you learn about dialysis kidney journeys, how the kidney work, and work with your team in collaborative environment, you get more comfortable. And really, any modality of dialysis is okay with me at this point. But if I had to go back on dialysis, I would still choose peritoneal dialysis as my first choice. A little bit different than John there. In terms of flexibility, the size of the machine and equipment to travel with was much easier for me to maneuver than a home hemodialysis machine. The PD cyclers usually range about 30 to 35 pounds. The newest Baxter Omnia is about 25 pounds. And then we have a Versi that's coming out with Fresenius that's even lighter than that Omnia coming into play there, the new cyclers that are easy to travel with. And then also there's a difference between doing the treatments on the cycler as well as during the manual treatment. And I was always taught with my initial PD nurse that you could adjust after the initial adjustment period where we have some baselines on you in terms of your performance in PD. You could actually adjust between doing manuals as well as cycler at home. And then they taught me how to make those adjustments as well. I think in terms of where you travel, it depends on which supplier you have. Baxter and Fresenius has different distribution networks around the world. If you're doing domestic travel, it's pretty easy for both companies. If you're trying to travel international, certain suppliers may not have distribution access to certain locations that you want to go to. So you do want to plan ahead for those. If you're going on a cruise, you do want to know that a lot of times there's a freight charge, but a lot of patients will go ahead and ship their solutions and supplies to a hotel the night before at the port that they're leaving from, and then transfer that via taxi or shuttle from there to avoid that freight charge from the suppliers. And then, of course, different countries in the world have different regulations in terms of medical supplies and equipment. So some places like Germany or Japan may be a little bit more restrictive to travel to and take a little bit more planning requirement. But for me, the evening plans or work schedules or long conference days, those didn't affect me with peritoneal dialysis at all. Once I went through the training for home hemodialysis, I was a little bit weaker then, certainly, and that machine is approximately 101 pounds versus the 35 pounds for peritoneal dialysis cyclers. So if you're just traveling on your own and moving about, that may take a little bit more effort, or you may need a little bit more assistance with SkyCabs or other folks to help you lift that equipment as well and transport it. And then another key difference in terms of travel with peritoneal dialysis machines is, for the most part, once again, you can fit those in the overhead bins. So I tend to travel sort of light, and that is allow me to get in and out of the airports a little bit quicker, whereas the home hemodialysis machines, you would need to check it because it will not fit in the overhead bins for the most part. But I was also able to do peritoneal dialysis during the day as well on certain days while I'm working at home as well. So different modalities certainly have different options and different ways of doing things. While we advertise that peritoneal dialysis, you could do it at night and while you sleep as a benefit, similar to nocturnal home hemodialysis. There are different ways that you could do it in different times of the day, usually, and you could just have that discussion in detail with your care nurse as well as your nephrologist to make a plan that works out ultimately for you at home. And this, of course, is very different than the in-center environment where you're dependent on when they have seats available, as well as if they have seats when you do travels at a different travel clinic. And I don't have to worry about that with home dialysis modalities, either PD or HAD, because I already have the supplies at home, or I could ship it ahead of time depending on where I'm going, and I could easily jump in a car or on a plane a little bit more easily. Not as easy as without dialysis post-transplant. I'll throw that note in because I'm back to traveling basically on a backpack and just a passport without any dialysis supplies. So I think you still want to aim for transplant as the ultimate goal if you're able to do that as well. But there are some different options there. Great question. Thanks.
Well, thank you. Yeah, no, thank you. Great information. You know, we're winding down on time here. Time always flies in these. So I want to, first of all, thank all of you for joining today. So much great information and so many opportunities, I think, for patients to explore home dialysis in the future. As we wrap up here, Dr. Bermudez, I'd like to return to you for just the final few minutes here. Just some takeaways. Really big things that patients, people who might be starting dialysis should know, as well as maybe some concrete things that they should do as they go into the future.
Sorry, I'm sorry.
There we go.
So I wanted to thank everyone, especially you too, for sharing your amazing life experiences. Nothing better than to listen from patients than from physicians. I would just say to everyone listening to strongly consider your options. As we've reinforced here during our hour, you may not be ready for one type of dialysis at some point, but options will always be there. And please, you know, reassess your options, talk to your team, and strongly consider home therapies, you know, for improvement of quality of life.
All right. Well, thank you very much. Greatly appreciate that. And I'll just wrap this up by saying, as there was a question online about life expectancy and time on dialysis, how long can I expect to live if I pick one modality or the other? You know, this is a scientifically controversial topic. The most important thing to remember is that dialysis needs to fit into your life. And there are lots of ways that every modality can be made better. So I just encourage everybody out there who's been joining us listening today to talk to your team about both in-center dialysis and, most importantly, talk about home dialysis and explore your options, because there are lots of options and they're always available to you. So thank you for joining us today. And to learn more information about home dialysis, please visit any of the links on the website currently displayed on your screen, including at the American Kidney Fund's website, as well as at Home Dialysis United. Thank you.